right, welcome to another episode of Plastic Surgery Uncensored. As always, I'm your host, Dr. Rady Rahban, and we have an interesting episode for you today. It's interesting. I think it's a very important episode, and it's something that I've been toying around with, or has been brought up multiple times, but I just think it's nice to go talk about it. So it's this notion or this idea that any surgeon today who is worth their weight in gold has to be a subspecialist in what they do, and that if you're a general plastic surgeon, basically you're no good. So let me elaborate a little bit so you understand. So not too long ago, I was in a room with one of my patients, and we were chatting, and I had done some body contouring procedure for them. And after the body contouring procedure, I noticed, like, I don't remember what I noticed, but I was like, hey, what's this? They're like, oh, yeah, I'm like, I don't know, 2 months out from a facelift. I was like, what? You can imagine my shock. They're like 6 months out from the surgery that I did, and somehow in the 6 months that they were recovering, they went and had got a facelift. Now, absolutely patient's prerogative, go wherever you want. But when I pressed them on it a little bit, I said, oh, that's interesting. Who'd you go to? They're like, oh, I went to so-and-so. And I said, that's great. And then they said, yeah, I would have came to you, but I know you just do body stuff. I was like, no, that's not accurate. I do a ton of facial surgery. It's like half of my practice. And they're like, really? And they were surprised. And it surprised me that they were surprised, because it was like, what do you mean you don't know that I do facial aesthetics? And so this topic has come up many, many times. So in general, plastic surgeons historically, when you wanted to do cosmetic surgery, facelift, eyelid, breast aug, tummy tuck, whatever, you went and saw a plastic surgeon. The end. And in the last 15, 20 years, all the other subspecialties, ENT, ear, nose, and throat, ophthalmology, dermatology, and let's say cosmetic and other cosmetic specialties, they started to develop this desire, hunger to do aesthetic surgery. And so as a result, each subspecialty then created their own aesthetic, if you will, training. And then they created, in addition to plastic surgeons, there became facial plastic surgeons. There became oculoplastic surgeons. There became oncoplastic surgeons. And there's all these names. And essentially what it was is these other subspecialties wanted to be involved in aesthetic surgery, and they created their own training, and that's fine. But what that did is it created this marketing ploy, in my opinion. And what they did is they deleted the oculo and the facial and the whatever, and they called themselves all plastic surgeons. But what they did is to say, I'm a plastic surgeon, but I only specialize in the face, suggesting that other plastic surgeons who do body work, well, that's what they specialize in. So it really kind of irks me, because in my opinion, a patient should go to a doctor not because they specialize, not because they market as this is what they do, but because their results are outstanding in the area of work that they do. So what I mean by that is, let's say, for example, I have chosen by choice. When I first went into practice, I remember the advice two senior plastic surgeons told me 20 years ago. Kid, if you want to survive in Beverly Hills with all the competition, just super specialize. Pick something you really like, and that's all I want you. That's what I suggest you do. So let's say you decide, hey man, I'm just going to do breasts. And the reason they told me that was because they knew that if I wanted to be successful in an environment as competitive plastics as Beverly Hills, then if I specialize in one area, I could make it to the top quicker. But in my opinion at the time, I was like, but why would I do that? I just finished training for like a gazillion years, one. Two, I really love the diversity of plastic surgery. That's why I went and became a plastic surgeon. So I resisted that advice. And as a result, I created a very successful practice doing the entire gamut of plastic surgery. That's right. I do eyelids, brow lifts, chin augs, rhinoplasty, facelifts, breast augs, tummy tucks, body contouring, weight. I do it all. Now, that doesn't mean I'm good or bad. It just means I do it all. So what I suggest to patients is while the marketing is nice, oh, I specialize in eyelids, you shouldn't not go to someone or go to someone purely because of the marketing. So what I would have hoped that patient would have done was say, hey, Dr. Rahban, do you do any facelifts? I'm just curious. I came to you. You obviously did an amazing job. I would have said, yes, I do. And they would have then done what? They would have gone to my gallery and pulled up my results. And one of two things would have happened. One, they would have said, ugh, wow, these are some shitty results. In which case they would have said, Dr. Rahban is amazing at body work. His facial work, not so good. Or they'd go like, well, holy shit. Wow, these are really good. This is incredible. His work is incredible. In which case, then I specialize in that too. The idea of specializing is a term I give to myself. And so at the end of the day, because plastic surgeons, cosmetic surgeons rely on their outcomes, they have outcomes that you can see. You can't go and go check out a GI doctor and see the results of their colonoscopy. You can't go to your general surgeon and see the results of their gallbladder removal. But with plastic surgery, there's no hiding. So if you go to a guy that's world renowned for eyelids and his eyelid work is shit, then he sucks. If you go to a guy who you went to for your breast dog, but their facelift work is amazing, well, then they're amazing. So it really kind of annoyed and irked me because you're getting penalized for, in my opinion, having a broad and very diverse practice. And I wanted to make sure there was no misconception about this, that anyone that is a specialist or a generalist, it's just nonsense. It's a lot of marketing in a very, very highly densely concentrated environment like Beverly Hills, and everyone is clamoring for patients, and everyone will market the shit out of themselves as being unique or special, or I do it only this way, and no one does it that way, and it's just not realistic. The bottom line and the only thing that ever matters is outcomes, and you can't hide from outcomes. They're right there on the screen for everyone to see. So I hope that adds some clarity for you. I hope that if you're out there and you're like, oh, I wonder what this doctor does, ask the damn doctor what it is that they do. Go onto their website, look at their work, and if you, and only you, don't like the outcomes or you don't see many of them. Conversely, if you went and you're like, oh, wait, there's like 4 eyelids here. Well, then I don't do them, do I? It's obvious. But if you go and you see amazing work from a plastic surgeon you like, don't be fooled by the marketing that he or she is or isn't this or that the other. The proof is in the pudding. The proof is in the work. Okay? So I had to get that rant out because it was driving me nuts. It annoys the hell out of me. And at any rate, that's that. So I hope that helps. That wraps up a very quick and short episode of Plastic Surgery Uncensored. As always, I ask for you 2 things. 1, if you dig the show, go out there, write us a good review. Go write something nice. Everybody, even Sally, who's here on a weekend, would love to read something nice. Throw Sally's name in there. It makes her happy. And the second is share our podcast with people you know and love. Don't wait for them to ask for it. Share it with them without them asking, because you don't know when they're going to go do something and have a shitty outcome. All right? At any rate, that's a wrap. We will see you guys next week on Plastic Surgery Uncensored.